Safety in general, or safety considering the operations and non-surgical interventions, because in both areas there are a lot of things to be discussed. One of the basic things, and I think that all doctors have to be considered, it's about the ethics of the treatments that we are offering. Most of the treatments are treatments that they are trends in the moment, they are in fashion. People want to have these changes, but they cannot see the long-term results and the long-term problems that could be created. I mean,
so it's your job as a surgeon?
Yes, to be like, to have the role of a policeman, let's say, a beauty policeman, and somehow give the orientation or the borders of what is accepted and what is real and what can be done from the fantastic world that social media are showing to us. And we have somehow to win the confidence and the acceptance of people to understand that someone who is having a very long time dealing with all these problems, working on these specific areas, has more experience and knowledge to prevent.
What do you do with the patient if the goals are not realistic?
If the goals they are not realistic and we are not the ones that we are responsible for their decision, what we can simply do is just decline the patient and just refuse to do any further treatment.
And what would be not realistic goal with a facelift, for example?
Facelift, I mean, we have a specific way what results we would like to obtain. What I like to, when I'm doing a facelift, what are my expectancies, what I expect from the result. So I want a natural result. I want a person who can move and express him or herself naturally. And I cannot make them look like they're in the early 20s, but I can make them look very decent in their age and to have a significantly big difference within the people of their age. So if for example, there is a meeting of schoolmates and they're in the 50s or the 60s, you can significantly see the ones that I treated from the ones that they were untreated. And this is something that, I mean, this is a result that makes me happy and make those people happy and long-term clients.
But just one facelift would not solve the problem.
No,
you have
no,
to
no.
come in for different...
There are, facelift is actually solving the loss of elasticity and the looseness of the underlying structures. So we need to readdress that with a proper axis to give a natural look and appearance. That's the only thing. We are not going to see the results that we've seen in facelifts 30 or 40 years ago, when people look like they're running high speed in a motorbike without a helmet. I mean, and people that they were always smiling no matter what.
A natural clinic, like, do you have solution for maintaining the face?
Yes, of course,
well?
because...
so you have like out-of-patient?
Of course. We are dealing with all the issues that they can appear in time, but we also have a preventive, let's say, role, and we can help to delay the aging process.